So my name's Courtney. I'm 27 years old. I have an identical twin sister and a little sister who's 13. I work at St. Louis Children's Hospital as a GI nurse. I started there in the OR, and I have a handful of medical conditions. And actually, the current hospital I work at, I've had 50 surgeries there. And a really cool thing is being an OR nurse, I got to work alongside one of my main surgeons who worked on me to make me who I am today. So it was really cool.
That is awesome. So you really have come, full circle with your journey, it sounds like. Explain, what is your personal health history? What have you been diagnosed with?
So some of the things I've been diagnosed with, and if you want to, I can explain some of them because some of them are.
Sure, it gets tricky.
It does get
Target
tricky.
is tricky.
Yeah, I have a couple rare ones. So one of them I'll start with is I have spina bifida, myelomeningocele. So that is when the spinal cord is exposed when you're born, and it can either just affect the surface of it or the actual cord. I have the most severe form, and so my cord was outside of my body when I was born. Wow. And I was told I wouldn't walk or anything, but I do walk. I wear a leg brace on my left leg. I call it my lucky pin. And I have years of PT to help me walk, and then multiple feet and leg surgeries to help keep my legs and feet working. I was also born with clubfoot. So clubfoot is basically when a baby's feet are born inwards like this. And so both my feet were born inward. And so I had, again, multiple surgeries and castings, bracings to help straighten them, and again, to help me walk. I also have short gut. So short gut means that either you're not born or you have a lot of your small intestine taken out. I wasn't born with a lot of it, and also had some of it taken out to make my bladder. And then I also have, for short gut, I have a colostomy. So a colostomy is just basically an opening in your abdomen to put out waste. I've had it since I was 2 days old. And I also have collateral exstrophy. So collateral exstrophy is when your bladder isn't formed, or it's on the outside of your body. Also, your intestines are on the outside. I had all three bladders made from my small intestines, and I use something called a metrophenoff, which basically they take part of your appendix or small intestines to make a channel from your bladder outside to your body, and you use a catheter to self-cath of everything.
I mean, that is so much, Courtney, that you've been through. So do you think that it was because of your experiences that you went through as a patient that you are now a nurse?
Oh, yes, for sure. I always knew I wanted to help people and help kids like me since I was a little kid. But I also wanted to be a nurse because nurses, we have more patient interaction than doctors, because they're just so busy. That thing, I like the patient interaction I always had with my nurses, and I wanted to get back to the hospital that I was at multiple times with all the doctor visits, hospitalizations, and then, like I said earlier, my surgeries. So yeah, it definitely inspired me to be a nurse today.
Yeah, it sounds like it. I mean, you're back where you're back where they saved you, essentially. I mean, totally sounds like you were meant to be there.
My home away from home.
Do you share your story openly with your patients?
I do. A lot of times when a patient has a similar situation or like chronic illnesses, I like to tell them just a little bit about what I went through, and their faces always light up and say, "Oh, you know exactly how I feel. I'm sick, I'm tired, lonely. All the being in the hospital all day. I'm falling behind with school." And so I just tell them, I totally get what you're going through. But my motto is just keep swimming, and that's what I kept doing.
Yeah. Were there any moments that you can reflect on in your experience, good or bad, that played a role in how you practice as a nurse today?
I remember my nurses that were not only good to me, but they also made sure my mom or any visitor that was with me made sure they were okay. If they needed even just a glass of water or blanket, they still checked in on them also. From the bad experiences, mine were more from my ostomy. A lot of people think they are gross, disgusting. And I've had a couple times where nurses just didn't want to help me change it when I was just too sick to help myself, or my passion is ostomies. Going to be working toward my WOCN, which is a wound ostomy continent nurse.
Okay.
And That's the type of nurse I eventually want to get to. Just got to go through more schooling. And I teach nurses now. I've done it for, I think, almost 6 years with the UOA in the SSM hospital district here. Just teach them about that. One, young people have them, because most
Yep.
people think about older people that have them, and that they're not gross, they're not disgusting. They help you live a lot better. So I just teach them basic care, and then that you can still do anything you want. I attend a camp, it's called Youth Rally, and it's for kids with bowel or bladder disorders from ages 11 to 17. I've been attending since I was 14 years old. And it's an amazing camp. It's for kids all over the United States. We have a couple people internationally also, and we teach them how to be independent about not only their diagnoses but other diagnoses. They get to meet kids who have their diagnosis or other diagnoses, and they're from all over the United States. So
But everything that you've gone through actually makes you an asset, because not only do you have the book smarts, but you have, and so to speak, the street smarts. I mean, you've experienced it as a patient as
I
well.
also love the patients I work with and love just talking to them, and even the parents, just giving them hope, even though they get like a diagnosis or, Crohn's colitis, or, they just found out their baby needs ostomy. They just diagnosed spina bifida, scoliosis, or even just any other illnesses. I like to just give them a little insight, say, hey, I know doctors are going to give you all this information thrown at once. They're going to say, my mom was told I wouldn't live past one, I wouldn't walk, I wouldn't talk, I wouldn't be independent, all that. But here I am today. I believe anyone can do anything they want. You just got to put your mind to it.
Do you have a message that you would like to share with anyone that may be watching this that you think may relate?
Just don't forget to just keep swimming.